Hello, and welcome to this week's program of the Rotary E-Club of Silicon Valley. Each week, we connect with and hear from fascinating and inspirational speakers, often with a message focused on our interests in innovation, entrepreneurship, and education. My name is Farheen, and I thank you for joining us today. This week, we have Joyce Mmaitsi, who will be presenting to us their work with Safari Doctors. Joyce is the program officer for Safari Doctors and has over 15 years of experience of focused program development and community engagement in Kenya and Southeast Asia. For several days each month, she can be found on the Safari Doctors boat heading out to remote villages in Lamu, archipelago, to coordinate mobile clinics for marginalized communities. Joyce is passionate about helping others and says, there's always something we can do for the less fortunate. And with that, Joyce, please take it away.
Good morning to you all. It's evening for us here, but thank you for having us. Farheen, thank you for setting up this forum for us to meet and speak. I think I should also say thank you to Keith and his group for talking about our work that we're doing here in Lamu, and also recommending us to participate in this forum and to just give a little more about what it is that we do here in Lamu. So I will begin my presentation. One moment. Oh, sorry. Sorry, give me 1 minute. Right, so are you able to see the presentation?
Yes.
Okay, so Safari Doctors, our journey began in 2015. Our founder, Omar, came home on holiday and felt that she needed to do something when she realized that the people in her community are still having challenges in accessing healthcare. And so the team that we have assembled here has medical volunteers who work to provide healthcare in about 8 to 10 villages of the Aware and Bajuni communities in Lamu. They live within the archipelago and on the mainland and near the border, mostly near the border with Somalia. And the main challenge is that because of the challenges of accessing them and the issues of insecurity, then it's all impeded their access to healthcare. Every month we sail in a boat, and now we have a speedboat, so our trips are a little bit faster than going in a dhow. But we do 4-day trips to all the 8 villages, where we go 2 days per village, 2 villages per day. And we basically provide them with the treatment and spend some time giving them basic information about health in their communities. Now, together with the outreach work, we're reaching about 800 patients per outreach, and that's on a monthly basis. So there is quite a big need for healthcare in these communities. We also treat animals, and for every outreach, we are treating up to about 200 animals. And what we've noticed is that over time, the children immunization is improved. The skin conditions that they've been facing because of lack of access to clean water have also improved. And the communicable diseases are down, and importantly, the expectant mothers are attending the antenatal appointments and getting all the support they need from qualified medics, including family planning advice and medication. Sorry, I should have gone around. One of the key activities we have is that we're engaging the youth as well in what we call the Youth Ambassadors Program. And we're dealing with young men and women, and where we give them basic health education and training to help them facilitate that same communication within their communities. And they're basically our eyes and ears in the community. So they're able to speak to the community members about the basic healthcare requirements that they should be following, and as well following up with us when they find they have serious issues that are coming up in the community, and instead of waiting for an outreach, then they're able to reach out to us and ask us to support them in whatever way we can. I had mentioned about caring for animals. We're trying to embody the spirit of One Health, because of the issue of the transfer of diseases between humans and animals. And we realized that part of the issues that the community members are facing, particularly with skin issues, relates to their interaction with animals. So we have a vet on board who goes out on outreaches and treats out the animals. I think you can see the photo there of the vet treating the dogs and donkeys and everything. And one of the things is that he's also providing support within the Shela community, not just the villages outside when we go on the outreaches. The main vision for Safari Doctors is that we want to ensure that the communities that we're living in at the moment are thriving. They have access to adequate healthcare and affordable healthcare solutions, and at the end of it, providing improved livelihoods in these communities. And based on the work that we've been doing, our founder and the team were actually awarded by the UN an award for being the UN Person of the Year, just recognizing the kind of work that has been done. It's quite a challenge because access to these communities is mainly by boat. It's very few of the areas that you can easily travel by road, or the road network is not really very good. And of course, as I mentioned earlier, the issues of security. And so all our activities are based on first having a communication with our security agencies and trying to find out whether it's safe for us to go out on the outreaches, and where they have concerns about security issues, then we're not able to go to. And the challenge we have is that there is a significant number of villages that still don't have access to healthcare based on the issues around security. And what we've done is the partnership that we have with the county government, where they support us sometimes with medication that when we're going out on outreaches. They support us with especially the maternal and child health care medication and the information. And we're working with some of the staff from the county, the nurses in some of the clinics that are there, and as well as the community health volunteers. And I think that engagement for us has helped bridge that gap that there is in healthcare in the communities, and also to cement the relationships that with the county government, and where they recognize the kind of work that Safari Doctors is actually doing in providing healthcare in these communities. And to wrap it up, I mean, we're also very big on sharing what we're doing, mainly as a learning for other agencies and other organizations as well, and also to get people who can support us in whatever way possible, whether it is giving us access to information, whether it's joining us as volunteers for the various activities that we're doing on the ground. Where I think we are on social media, all social media, and I think our contacts are there, and you're welcome to get in touch with us at any time. To learn more beyond even just this forum, and to join us as well. Yeah, Farheen?
Wonderful. Thank you so much. Go ahead and unshare your screen, and we can come back together as a group. Perfect. So thank you so much for your wonderful presentation. Are there any questions from the group? Yes, Keith.
Unmute here. Thank you so much, Joyce, for coming and presenting to our group. Several of our members were in Lamu in July, as Alex mentioned.
Yes.
Our group was about 18 people, and I did a program on that a couple weeks ago. But
yes.
And out of our group, I think there's a third of us are Rotarians. And one of the things we're trying to do is to
yes.
help you raise enough money for what they call a sail, which I understand is
yes.
to go out on a sailing trip to take supplies to one of these remote villages.
Yes.
And one of the other people asked me to ask you. I know we've raised a fairly good amount just amongst ourselves so far, and we're
yes.
trying to raise the amount for a full sail. Do you know where we stand on that fundraising effort? That sail?
Well, my colleague Clementine is the one who's actually responsible for the following up on the contributions that coming to Safari Doctors. I will definitely ask her to get in touch with you, just to give you an update of where we are with the donations. Of course, for obvious reasons, we're not able to just put that information out there. But I think for those who might not know what the funding a sale means, is that every month when we go out on the clinics, a full sale, which means paying for the boat, paying for the medication, and all other logistical issues that go with the 4-day outreach visits, costs about $3,000. So we've given an opportunity to people on our website to choose the sort of method they feel comfortable to share in. It could be an individual pledge, it could be sponsoring a sale as Keith's group is doing, and thank you very much for that, Keith. It could be as simple as just saying you're donating the medication for a month, which comes to about $800. We've broken down the various opportunities. For example, of funding fueling the journey, which will be about $400. So we've given lots of options on the website, and my colleague Clementine will be able to adequately inform those who are interested on how best to go about donating. And we also have a partnership with the Village Experience, where our those of us, the friends of safari doctors that are based in the US can actually get in touch with the Village Experience through their website and follow up with donations.
Thank you.
Any other questions? Yes, Cecilia.
Yes, hi Joyce. Thank you for your presentation. So a question that I have is, is there the potential in any of the villages that you're working in to develop some medical capacity among the villagers where they could sort of perform some basic functions that don't require a medical license, for example?
Yes, and I think that's why we have the Youth Ambassadors program. What we do with the Youth Ambassadors program is that every month we're taking them through training on various aspects of health. So, for example, we've trained them on first aid, so they're able to give the basic first aid in their communities and be a first line of help to the community members. We've trained them on leadership skills. We are training them on reproductive health. In fact, we are having a training next week on reproductive health, which is now we're using the trainers and facilitators that come in from the county government to ensure that we have a streamlined sort of communication that we're sending to the community members. And every month we're trying to come up with different training activities, and we're planning now for one on population health and environment, for them to understand the nexus between the population, the health issues, and the environment, and which is what we do. They go back to the communities, they have these sessions with their peers, they have these sessions with the community members, either through their Friday mosque prayers, or just on a one-on-one basis with the people they're with. We've had a training on water, sanitation, and hygiene. And in the last month, they've had sessions in the schools where they've been teaching the children how to do proper hand washing, for example. And for them, the interest has been very, very welcomed. They've been very warmly welcomed by the communities. And the community members do raise this when they come to say that we are happy we have these people who are a link between us and you. And one of the problems we have in some of these villages is that there's no access to a proper mobile network system. So it means that somebody has to go to a certain spot so that they can reach to a network system so that they're able to communicate some of these challenges that they're facing in the community. So yes, to answer you, we do have that. When we train the youth ambassadors, every month they go back and then we do the follow-ups with them. We've also had a partnership with one of the UN agencies who have heard about the work that our youth ambassadors are doing, and they took them up and took them through a training on gender-based violence. And they're also following up with them in the communities just to coach them and to mentor them about how to engage with the community on various issues about health, women, and society as in general.
That's quite a, schedule of things that you have going on. And so how is the connectivity in these villages? Is it sporadic? Is it non-existent? Is it, you mentioned having to go to a central place. The reason I ask is because one of the Rotarians here in our district
Yes.
is doing a global telemedicine effort. It's going to be a very big organization with
Yes.
lots of volunteer doctors, where if you can get someone connected to where they can, contact this organization,
Yes.
apparently about 80% of medical issues can be diagnosed through a video conference system such as what we have.
Yes.
And so people can get medical care that they might not be able to get otherwise.
Yes. Well, as I said, the challenge is in getting proper internet connectivity, or even more just basic mobile connectivity in these villages. And so I think there has been an effort to engage the county hospitals in telemedicine. I think it's something that's still a work in progress. I believe one of the mobile companies, Safaricom and Huawei Technologies, are trying to see how best they can institute this in the county hospitals. And for us, the best that we're doing is that we're trying to be the link between the community and the main hospitals. And what we do is that we're now starting a process where we can collect our data, and we're using some software from a company that approached us, and we're piloting right now, just trying to see how we can collect this data, how we can have ready data access for the county hospital to use, especially in those areas that they're not going to. But the issue of the connectivity is all depends on how the companies, and when they look at the feasibility and they see whether it's a possibility for them to set up these to set up a proper system for them to use. But for now, what we're using is when we need to talk to our ambassadors, we send in a message, and it will pop in at some point when they're walking in, and they'll be aware, okay, that they need to get in touch with us, and then that's how we're struggling with it. It's a challenge, I can say that. In Lamu, the main town is quite okay. The connectivity is quite good. The challenge is in the villages that are out there.
Right.
Yes.
Yeah. Well, I've spent some time in Eastern Kenya on more than one occasion, and I do understand a lot of the issues there. Sparse population, inconsistent services. But it's a really wonderful place. And so I'm curious, and then this will be my last question. How often do you have issues where you cannot reach certain communities because of the security situation?
Well, at the moment, the 8 to 10 villages that we're going in are relatively okay. And that's why I mentioned that before we go out on our outreaches, we have to speak to the head of security in the county, who is called the county commissioner.
Right.
And we update him on the dates that we're going to go out on outreach. And they sort of give us the go ahead based on the security information that they have. And sometimes when the community members will actually tell us, okay, we are hearing a little bit of chatter, it might not be such a good chance to go to some of these villages. But for the 8 to 10 that we are going to, we've so far had no problem, and we're thankful for that. And I mentioned that there are some others who are in dire need, but because of the issues of security which are not yet clear, we really cannot go there. Although the government is working very hard to ensure that they stabilize those areas, and by their own efforts, they've had to sometimes get helicopters to fly in doctors to ensure that they've done immunizations for the children, and to make sure that basic healthcare is provided to them, with the women and the children there, and then to fly out their doctors. So they're not completely cut off, but then there's that overarching issue in some of the villages. But for our villages, so far we've been okay. We've had no problem.
Great.
Yes.
Thank you.
Any other questions? Alex, Mary Jo? If not, I will speak. If Alex, maybe you might have something. Okay. Mary Jo, do you have any questions? Okay, so let me ask one. Joyce, again, thank you so much for your presentation. I really enjoyed it. I thought what was something that was really striking to me was the idea of having a vet on board. I didn't really even think about that, right? But you are totally right when we think about how, I mean, a lot of diseases are kind of transferred, from animals. So that makes perfect sense that when the animals are healthy, the people are more healthy. So I thought that was really novel and really really smart. So that was just my comment. And then in terms of my question, so many of them have been answered, but one question is, where are the doctors, kind of coming from? Are they kind of in the hospitals, or are they from abroad, or where are the doctors coming from?
So at the moment, we are working with volunteer doctors. We have a full-time nurse on board, and he works he's mainly with the county, but supports the program on a regular basis every month. But the doctors we work with are mostly volunteer doctors. We have them from Lamu County itself, some of them who are attached to some of the hospitals within Lamu County. And we've had interest from some of the doctors that are in Nairobi. And so when their schedule allows them, then they join us at no cost at all. So what we do is just we facilitate their travel here. And that's what when you're funding a sale, that is what some of the costs go towards, ensuring that we can get the doctors here to come and support the activities we're doing. And one other program we had, which I didn't talk about, is also the volunteer medical students. Over the past year, we've had some students coming in from some of the schools in Spain mostly, and I think from Brazil as well, who've come and spent some time, about 4 weeks here, where they get to just experience what it is to do healthcare in such a setting. And of course, through our website, you'll see that we've also left it open. So for anybody who's a qualified medic wherever they are in the world, can get in touch with us, and then we can inform them about what the procedure is to be licensed to come and treat people in Lamu. And I think one other good part is we've been having a partnership with some of the Turkish doctors who then come to the county hospital, spend about a week, and then they take care of some of the urgent cases that come in if they need to do surgeries, or the kind of support that we're giving, especially with some of our referral patients from the villages and from the outreaches. Then we've had that sort of partnership. So we're mainly working with volunteer doctors, and they come from anywhere in Kenya and anywhere in the world.
That's awesome. I hope one day I will be able to go. That's
I'm much welcome to come and join us on one of our outreaches.
I would love it. Okay, it'll be on my goal list for when I become a doctor. Head to Lamu with safari doctors.
Yes.
Okay. And then one more question I had. You mentioned mosques. So in these villages, are they mainly kind of like Muslim communities? And if so, I'm curious to see, like, are the doctors also Muslim as well?
Yes, I think almost like 90% of Lamu is Muslim, the Muslim faith. And so for us, we find that part of the gatekeepers we need to interact with before we do any activities on the ground is definitely those, the imams in the mosques. And what we do is that, so part of the training that the ambassadors do is they go to the mosque and they'll talk to them about various issues, if it's hypertension, if it's diabetes management, just informing them that the outreaches are coming as a way to just get to make sure that we have people coming to attend the clinics. And so, yes, it's mostly the Muslims, and our doctors, anybody is welcome to come and treat the patients, as long as, of course, we observe the respect to the culture of the communities that we're working in. So we have a mixed bag. It's open to anybody. We have no restrictions on who is coming, as long as you pass your security checks and we make sure that you have the proper documentation. Then we welcome anybody to come and join us.
Yeah, that's incredible. Yes, I'm gotten more excited. I'm like, I really want to go one day, one day.
Yes.
Are there any other questions from the group? No. Okay. Oh, Keith. Yes.
Yeah, I just want to again thank Alex and Mary Jo from our group for attending this recording. They're both non-Rotarians, but they are very supportive of Safari Doctors and H2 Open Doors. So thanks thanks to Alex and Mary Jo for attending this morning.
Perfect. So before Joyce gives us her final words, I would like to encourage everyone watching to leave a comment below. Members and Rotarian guests, please make sure to fill out the attendance section. And as always, I would like to give the final word to our speaker.
Well, again, I say thank you for giving us this opportunity to share about what we're doing. And thank you to the Rotarians that came here and provided the water system, purifying system to the village. I think you did see what a challenge it is to access the village and the sort of conditions that they live in. And as Safari Doctors, we are ready to welcome supporters. Talk about us to your friends, talk about us to your networks and your communities. And I think we look forward to joining hands in any way possible to just help us in meeting these the objectives that we've set. And for sure, the communities do appreciate the support that they get from friends, and when they know that we're able to go there every month, it's a regular, it's a committed, and it's a sure thing that we'll be there every month to provide them with the healthcare services. This appreciation on their end. I mean, every village, on average, we're seeing about 100 patients in every village, and sometimes when the nurses in the health centers in some of those areas are not there, then we're providing that extra backstopping support, and they know that for sure the nurse is away, but the Safari Doctors will come, we'll be able to get our healthcare. So in our own small way, we're trying to contribute towards the government's efforts to achieve the universal healthcare agenda. And it is the president's main concern about ensuring that all citizens get access to affordable healthcare. So whatever support we've gotten from all of you, even just giving us this opportunity to speak to your members and generally the world, we're very thankful for it, and we do not take it for granted, the kind of support that's coming from friends. It could be just sharing experiences, coming to volunteer, or even donating funds to the activities that we're doing. We're very thankful for it, and we look forward to having more people join us and see what it is that we're doing here to provide healthcare to the people in Lamu.
Perfect. Thank you so much, Joyce.